Hi, I'm Dr. Vandana, and today I'm talking about common myths around diabetes and its truth. There are a number of myths about diabetes that are all too commonly reported as facts. These misinterpretations of diabetes can sometimes be harmful and lead to an unfair stigma around the condition. Diabetes information is widely available both from healthcare professionals and the internet, but not all of it is true. It can be hard to know what is accurate, so this video aims to highlight the top 8 of the most common diabetes myths. As well as diabetes myth, you may be interested in these diabetes facts. Myth number 1: people with diabetes can't eat sugar. This is one of the most common diabetes myth that people with the condition have to eat a sugar-free diet. People with diabetes need to eat a diet that is balanced, which can include some sugar in moderation. Myth number 2: type 2 diabetes is mild. This myth is widely repeated, but of course it isn't true. No form of diabetes is mild. If type 2 diabetes is poorly managed, it can lead to serious, even life threatening complications. Good control of diabetes can significantly decrease the risk of complications, but this doesn't mean the condition itself is not serious. Myth number 3: type 2 diabetes only affect overweight people. Type 2 diabetes is often associated with being overweight and obese. It is patently untrue that type 2 diabetes only affects overweight people. Around 20% of people with type 2 diabetes are of normal weight or underweight. Myth number 4: people with diabetes go blind and lose their legs. Diabetes is a leading cause of blindness and also causes many amputation each year. However, those people with diabetes that control blood pressure, glucose level in the body, weight, quit smoking, all increases the chance of remaining complication free. Blindness and amputation are therefore preventable, and the vast majority of people with diabetes will avoid blindness and amputation, particularly if annual diabetic health checks are attended each year. Myth number 5: people with diabetes shouldn't play sport. High prominence diabetic sports men and women have disapproved this diabetes myth. People with diabetes should take part in exercise to maintain a healthy lifestyle. Of course, there are some factors worth considering before partaking in sports, but there is no reason why people with diabetes can't participate in most cases. Myth number 6: people with diabetes can't do many jobs. Having diabetes won't stop you from having a job. Myth number 7: people with diabetes are more likely to be ill. People with diabetes are not more likely to have cold or other illnesses. The significance of illness for people with diabetes is that it can make the management of blood glucose levels more difficult, which can increase the severity of an illness or infection. Prevention of illnesses in particular important, and therefore flu shots are advisable. Myth number 8: diabetes is contagious. Something of a classic playground myth. Diabetes cannot be caught off someone else. Diabetes is categorized as being a non communicable illness, meaning it cannot be passed on by sneezing, through touch, or via blood or any other person to person. Means the only way in which diabetes can be passed is from parents to their own children, but even this is only a genetic likelihood of diabetes and not the condition itself.